So hello, everyone. Thank you for your patience. My name is Stacy, and I will be your webinar host this afternoon. Thank you all for joining us for providing vaccines and other preventative care to shelter animals the fear-free way. Today's presentation is brought to you by our friends at Elanco, and presenting today will be Dr. Meghan Herron. This presentation is RACE approved for 1 CE credit. And some quick housekeeping before we begin again. There should be 2 options on your Zoom control panel. You can use that chat feature as well as the question and answer feature. We will have some time at the end of the presentation to address questions from the audience. So if you have a question, please use the Q&A box so we can keep track of those and we don't lose it in the open audience chat. RACE certificates will be emailed to all attendees within the next 7 days, so be sure to keep your eye on your email for that. We're so excited to have Dr. Meghan Herron here with us to present today. Dr. Herron is the Senior Director of Behavioral Medicine, Education, and Outreach at Gigi's, a shelter organization dedicated to improving the lives of shelter dogs. Prior to her current position, she spent over a decade as an associate professor in the Department of Veterinary Clinical Sciences as head of the Behavior Medicine Service at The Ohio State University Medical Center. She graduated from the Ohio State University College of Veterinary Medicine and became board certified as a diplomat of the American College of Veterinary Behavior after completing a residency at the University of Pennsylvania School of Veterinary Medicine. She's a published author and seasoned international speaker. She's given lectures and seminars on animal behavior around the United States, Canada, Europe, and Australia. Dr. Herron, we're so excited to have you with us today. So on that note, I'll pass it over to you and we will get started with today's presentation.
Wonderful. Thank you so much. And thank you to both Fear-Free and Elanco for making this possible. It's a subject that's near and dear to my heart. As you mentioned, I am in the trenches of the shelter and really have been striving to make sure Fear-Free is an integrated part of everything we do here. And I'm very fortunate to have a team that is fully on board and having fully certified Fear-Free staff here at our shelter. So today we'll talk about providing vaccines and other preventive care to shelter animals the Fear-Free way. All right, so hopefully most of you are familiar with the recently published American Association of Shelter Veterinarians Guidelines for Standard of Care in Animal Shelters. So this is a new revised edition that just came out in December of 2022, so really fresh off the press. I just want to share what their recommendations are for at least their vaccine schedule as well as other preventive measures. So they are recommending the modified live versions of distemper parvo as well as the FERCP vaccines for cats. Now, in a general practice, we tend to booster every 3 to 4 weeks, but in a shelter environment where we are in potentially a higher risk for infectious disease environment, we are vaccinating at intake and then every 2 weeks for puppies and kittens, and then just a single booster vaccine at the 2-week point for adults. As well as the modified live, currently the recommendation is the modified live virus, Bordetella, parainfluenza, intranasal vaccine. That mucosal immunity stimulation is super important. So the injectables are not recommended for Bordetella in shelter environments. And then clearly the rabies vaccine at 12 weeks of age and older. As far as endo and ecto-parasite control, they are recommending that all dogs and cats older than 2 weeks are treated for both roundworms and hookworms at intake. So here at Gigi's, we are not automatically doing a fecal on our dogs. We are just prophylactically treating everybody. We assume that they are coming in and it's a safe treatment to do that. And really, they should all be treated as well, even if you're not finding evidence of them, with anti-parasiticides for fleas and hopefully for ticks as well throughout their shelter stay. There also is a recommendation. Now, the quote from the recommendations is that each shelter have a plan or policy regarding heartworm testing and treatment. It's not necessarily mandating that everyone invest in these treatments because a lot of these tests can be expensive, but they definitely need a plan for how they're going to have this testing done, at minimum heartworm testing. And I think that leaves it open for shelters to decide whether or not they are also testing for tick-borne disease, as well as for cats, the FIV and FeLV testing. So that's not strictly mentioned in the shelter guidelines. But clearly, depending on your area, We get our dogs from rural areas in Southern Ohio where a lot of tick-borne illness is prevalent. So we are testing most of our dogs, particularly if there's evidence of ticks. All right, so when our dogs and cats come to our shelter at intake, we have quite a few tasks to do. It can be overwhelming for the staff to think of this hefty task that we have to get done, and we're trying to get it done quickly and efficiently. But these poor pets, if we're not careful, they're already so stressed out at intake that everything we do to them from a medical standpoint shouldn't be adding to that stress. So the focus of today is to walk through how we can get through all of these to-dos in the best fear-free manner as possible. All right, and so really before we begin any fear-free discussion, it's important for everyone to have a thorough understanding of our signs of fear, anxiety, and stress and frustration. So we have these scales both for dogs and cats, which really walk us through low levels of FAS up to high levels of FAS from a scale of green, why this is automatically going, from a green to red. So green being a relaxed animal, low levels of FAS, relaxed, mild signs. Really, this is what we strive for in a shelter setting. This is difficult to achieve. We should always be striving to do everything we can to push these dogs and cats closer to green. Moderate FAS, these are dogs and cats showing moderate signs of stress, whether that's becoming more vigilant to the environment, looking for means to escape, or sometimes showing early signs of defensive aggression. And then our red or high level of FAS dogs and cats are those with severe signs of distress. They're fleeing, they're fighting, they're becoming potentially aggressive, or really just in a state of total shock and shutdown. And I just want to point out that dogs or cats in a state of total shutdown where they are just completely frozen in fear, in some cases, particularly with cats, it makes them a lot easier to handle. But it was really important for us as shelter professionals to recognize that these dogs and cats are experiencing as great a level of FAS as the animals that are trying to flee or the animals that are trying to bite and scratch us to protect themselves, and that we shouldn't be taking advantage of that state. We still need to work to implement measures in as fear-free manner as possible so that we can push those FAS levels into the low levels as possible. All right, so we talked about getting weights on our patients. It's typically one of the first things we need to do because it allows us to prescribe our anti-parasiticides, our dewormers to the appropriate weight of the dog, as well as make their feeding schedules and other things and other treatments. But getting on the scale can sometimes be the biggest challenge for some of these patients, particularly dogs, when the hope is that we can walk them onto this scale. I have a couple videos here I'll show you. The first one is kind of what not to do. If you were a live audience in front of me, I would poll you, say, watch this video and tell me what you think I could make better about this. So I'll play this. And just look at the body language of this puppy. I got the tucked tail, I got the ears back, lip licking. Puppy was pretty reluctant to enter that scale. Whereas if you look at this next video here, you'll notice the body language is quite different and our FAS level is much lower. So I would say the video I just showed you is probably a yellow dog, where in the video here, a little closer to bouncing, we're wiggly, our ears are up, we're eating, and there's no reluctance, there's no hesitation. So some of the biggest differences you're going to notice between these two is my approach. So a lot of scales, unfortunately, are put in corners where they're out of the way, which creates a dead end for these dogs. So we're essentially walking them into a wall, which most animals really don't feel comfortable doing. Also, you'll notice I was able to use food, which I'll talk about later, for counter conditioning, which is motivating the dog to feel good, to have positive emotions, and to walk readily on the scale. You'll notice the path I took in the second video was a circular motion. I was also walking what I do call walking with purpose. So walking at a moderate pace, not stopping, not hesitating when we reach that scale, and I'm making a loop where I circle around so that the dog has a clear, uninhibited path when walking onto the scale. So rather than walking onto the wall, into the wall from the side of the scale, I walk parallel to the wall up onto the scale. All right, so ideals are to encourage them to step up on their own, avoid dead ends, keep your pace quick and deliberate, and use food to motivate. All right, so now that we've got our weight, let's talk about setting up our exam space for success. So when we think about audiovisual considerations, Keep in mind that dogs and cats have what's called a tapetum. That is a reflective surface on the back of their retinas. So if you see a cat or dog in headlights at night, you'll notice their eyes look yellow. That is the tapetum that allows them to have very excellent night vision. What the tapetum does is it bounces light back and forth throughout the globe of their eyeballs so that they see light much better. That also means that brightly lit rooms are going to be extra bright to dogs and cats compared to how they are for us as humans. And so ideally we have maybe the lights a little lower than what might be comfortable for us. Now, if we need to be investigating and seeing things, then we can have overhead lights, we can use our phones, or we can adjust the light temporarily when we need that higher light. But particularly for dogs that are showing FAS into the yellow or red levels, having that dimmer light is going to be helpful. And that's just a matter of getting an electrician to change your light switches to dimmers. It's not a fancy or super expensive thing to do, but it's very helpful, especially if we are going to be doing any sort of sedation. Trying to keep those lights low is very, very helpful. We also want to think about examining them in an area where we're blocking visual access to lots of other people and other animals. So if you've got a high volume, high quality spay neuter day where you've lots of dogs coming in, or say it's a large intake day for cats, we don't want them piled on top of each other. And if they're housed in the same room, we want to provide visual barriers. So we're covering their carriers, or we're putting barriers where they're not seeing each other and stressing each other out. We also want to be mindful of our own movements. So moving our hands quickly, rushing about the room to gather materials because we weren't well prepared is going to be very stressful to these patients. If you ever pay attention to a fearful animal and watch how they just sort of jolt and brace themselves every time we move our hands too quickly or race around the room. So it's important to set up your exam space well ahead of time. So you have your paperwork, you have your vaccines drawn, and if they need to be in a area on cold pack so that they stay cold, we can do that. So we're not having to open and close the refrigerator on and off again. And just having it all prepared to avoid those quick and sudden movements. When we think about what they're hearing from their perspective, speaking more softly and sparingly is going to be a benefit to them. I often will tell people, for dogs at least, speaking to them in that lighthearted, hey, little boy, kind of jolly tone of voice can sometimes be helpful. What I will say though, for a lot of our shelter patients, they're so stressed out that even that jolly talk can sometimes be hard on them. So keep our talking to a minimum at a soft level and in as lighthearted as it can be when we are speaking. If possible, our intake area should be in a quiet area, one that we can close the doors. If we need to play white noise and music, such as classical music, which has been shown to be relaxing in dogs, that's going to be ideal. So in our shelter, we have the benefit of having stereo systems that we can adjust in each room. So we have classical music we're playing at a low to moderate level, as well as white noise to block the noise of any sort of dogs or people they might hear outside of the exam room. They are so stressed coming into this intake room. Anything we can do to mitigate that environment before we even touch them is going to be helpful. So thinking about what they're smelling, so olfactory considerations. It's important to minimize harsh chemical scents, such as those from bleach or our high ammonia products. I'm a big fan of low odor disinfectants like Rescue by Virox, which is the accelerated hydrogen peroxide. So this is at the appropriate 16:1 ratio is going to kill parvovirus and really any of our other infectious diseases that we're worried about spreading. And so we use it available on a wipe as well as a spray, as well as something that we can add to our mop buckets. And it's not going to add any sort of harsh chemical smell that might be stressful for the animals. We can also add soothing scents to the exam room. So we use these diffusers, the essential oil diffusers that you have a little water. They do require a plug-in. And then we put a few drops of essential oils that include lavender and chamomile, because those are the two that have the science behind them to increase relaxation and decrease vocalization in shelter dogs. And we assume that translates also to cats. And we do know that these can also be soothing to humans. So those doing the intake exams that might be under a lot of stress, it can be soothing for them as well. So benefits for everyone involved. When we think about pheromonal enrichment, so synthetic pheromone products. So pheromones are chemicals by which animals will leave messages for each other, and they can mean a number of things. Really stressed out dogs and cats are going to be leaving around pheromones in the environment saying, I'm really stressed out. This is a scary place. So it's important to not only be wiping between animals to remove those stress pheromones, but also important to add appeasing pheromones, relaxing pheromones to the environment. If you have an exam room where you examine both dogs and cats, you can have both of these products. They don't counteract each other. Cats don't recognize the dog one, dogs don't recognize the cat one, so you can have both. Probably the most practical way is to have the plug-in diffusers, as you see up here on the right, both for the FeLV and Adaptil products. So FeLV is currently the most current product is going to be FeLV Optimum, which is a feline pheromone complex, which is going to really combine the beneficial effects both of FeLV Classic and the FeLV Multicat, so combining facial pheromone soothing as well as the mammary chain pheromones, whereas the Thunder Ease powered by Adaptil is going to have the mammary chain maternal pheromone that has a calming effect in dogs. So again, shouldn't be any harm to this, and it's definitely something to add to the environment just to help these dogs and cats feel as safe as possible. Also important to think about what the animals are feeling is from a physical standpoint. So we really want to minimize cold and slippery surfaces. One of my favorite products out there is the Easy Visit Pet Vet Mat. So this is an antimicrobial non-slip bottom and then a fully disinfectable top. That can be custom made with your logo or can come in just sort of generic paw print, which is what you use. It's pretty cute and very easy to disinfect and very comfortable on the feet or the paws of both dogs and cats. Now this mat is available in an exam table size that you're seeing here. It is also available in a longer size that fits most scales because that scale can be another cold, slippery surface if we're not careful. And as I said before, often our animals are reluctant to jump onto that scale. If it's cold and slippery, it's going to be even more challenging to get them to willingly walk onto that scale for you. If we don't have these mats, then using some sort of rubber backing with towels on top. If you have nothing else, a towel is going to be helpful. The problem with towels is that if there's not a no-slip rubber bottom to them, the towels may slip around and some animals may feel unstable. So the recommendation is to use some sort of non-slip padding as well as towels when possible. Then we think about starting our exam. And a lot of times the way we set off our first impression is really going to set the tone for how the rest of the exam as well as our preventive treatments are going to go. So for dogs, it's important, if possible, to allow them to come to us. We do almost all of our exams on the floor, even for small dogs. For very young puppies, from an infectious disease standpoint, we do typically have them on our exam table. So we're not having them walk on the floor where other dogs might have walked. But for the most part, our dogs, we are examining on the floor. And when we think about our body posture, so our body posture can be very intimidating, particularly in a small exam room where we have dogs that are already stressed out. So it's important that we reduce our threat level by turning our bodies to the side, by bending at the knees rather than the waist. So not leaning over to reach toward the dog, but rather turning to the side, bending at the knees and keeping that torso upright, patting our leg and letting the dog approach us. If the dog makes the choice to approach us, their FAS level is already moving more towards that grin because they're in control of the interaction and they're willingly coming to you. Even better yet, if this is a healthy dog, then we should be able to feed them. We need to be feeding them. We have delicious treats and we can go up the ladder of palatability from, regular dog, dry dog treats to more soft and stinky dog treats to palatable things, sticky things like cheese, baby food, and we'll talk about some options there. But if you can see in this video, this is a dog that was a little on the nervous side. Little, it might have been easier to examine on a table, but I allowed this girl to approach me. So you'll notice I'm just starting by introducing touch while the puppy speaks. I don't need to jump right into my exam. I can take a few moments. And then just to start, I call it my sneak exam. I just start gently touching them and moving my hands around before I start to add more pressure and do my full exam. And sometimes it's better to start from back to front or from middle to front. It's starting right with their face is often a little intimidating for them. So we sort of build trust by feeding treats and touching them in a gentle manner, and then moving to parts that are maybe a little more uncomfortable or socially invasive for them. For cats, I highly recommend utilizing the carrier for their exams. Most of your cats on intake are coming in a kennel in a carrier, ideally one that we can remove the top and keep that door in place so the cat feels like I've got this safe place that smells like me, where I can be examined. Now, clearly there are things like blood draws and other exams, parts of the exam that we do need to remove the cat from the carrier. But the majority of the exam can be done in the carrier, and I highly recommend utilizing that as a tool. So, all right, so I want to talk about a concept known as a touch gradient. There we go, sorry. So touch gradient is a fear-free concept where we will put hands on the dog in a spot that is more comfortable for them very gently, and we will move them gradually to the area that we want to investigate that might be maybe a little more uncomfortable for the dog or a little more socially invasive for them. Another part of touch gradient is that we are minimizing the stopping and starting of physical touch. That means we're kind of keeping a gentle hand on the dog at all times. During our examination from one part of the body to the other, we're just keeping hands on the dog. What can happen, or cat, whoever we're examining, because what can happen is that we're starting and stopping, starting and stopping. Some of these dogs that are already on a heightened state of arousal and vigilance, that each time we touch them, you can see their body sort of cringe, and it's just increasing their FAS level. So keeping a hand on them as we move from one part of the body to another. This is also important when we look at auscultation of the chest. And so when we're listening to the different parts of the heartbeat, listening to different parts of the lung fields, it can be easy to get in the habit of sort of popping that stethoscope on, removing it, and popping it into the next place. It's actually better if we just keep that stethoscope on them at all times. It always surprises me, the stethoscope, you think it's such a benign tool that we use. So many pets are afraid of it, right? It's this sort of connector. It forces us to have our body close to the animal. So we're having to lean in, and a lot of them are very intimidated by it. So utilizing a touch gradient and minimizing the stopping and starting, even for auscultation, is very helpful. So here's an example. You'll notice I'm starting, this is a dog where I'm wanting to investigate why he's licking his hind end. So I have an assistant who's feeding up front. Ideally, she would be holding his collar or keeping a hand on that leash. I think she just had a lot of trust in this dog who's very, very low FAS. But again, ideally, for safety, we should have a gentle hand on the collar at all times for these dogs. And then in the second video, you'll see I'm doing auscultation, where I keep that stethoscope touching the dog at all times. So just gently moving from one area of auscultation to another. I'm trying to keep facing the same direction as the dog so that I can keep an eye on his body language and his FAS levels. And I'm just keeping a hold of the collar. If he would become upset, I would have some control. For cats, towels are going to be an essential tool for providing security as well as safety to those handling. So this is Dr. Denise Johnson created these photos for me, where she really creates some good examples of the cat burrito, what we call. So this is a wrap. I want to say that probably the two most important concepts for toweling methods for cats are A, preventing forward movements so they don't feel like they're going to escape from us, as well as the prevention of flailing. This is true for both dogs and cats, but cats especially. If they start to move and they are flailing, that really can be very panic-inducing for them. And so the goal of the towels is to provide that kind of swaddle, that firm, balanced restraint where they feel secure, they feel safe, and we are preventing them from flailing. If needed, we can also use the towels to provide head concealment. If any of you have worked with feral cats before, a lot of times if we can just get them in a towel and cover their head, they feel hidden, and it's kind of like this, hey, if I can't see you, you can't get me sort of concept. And there actually was a study in laboratory cats where they showed cats that had the ability to be concealed, their stress levels went way down compared to cats that did not have the ability to be concealed. So covering of their heads so they feel like they're hidden can greatly reduce their FAS. It's also good for staff safety. If we're preventing forward movement, we have control of those front limbs that might scratch us, as well as control of the head and the mouth that would be a potential to bite us. And so creating that form of a half burrito or cat burrito allows you to sort of undo the back end if we need to do vaccinations or if we need to do blood draws, as is exemplified here in this photo. So counter conditioning. So this is a concept that's going to be very important for the rest of what we talk about. So counter conditioning is a form of classical conditioning where we change a negative emotional response into a positive one. And unfortunately, we have a lot of our shelter pets have learned to fear our clinic area. So if they had their intake exam and it was stressful there, or if they had their surgery in the medical area and it was stressful for them, trying to walk them there for a recheck or any other medical concern that pops up, you can just see their SAS level increase just by walking in that room. So ideally, we're utilizing counter conditioning, A, to prevent that from happening, and B, to counteract any potential harm that we might have done to them emotionally during any of these procedures. So the idea is that we replace the fear of this area and everything we do with them with a more positive emotion through counter conditioning. That way our vet clinic stimuli then trigger pleasant emotions. And it's super important to remember that pleasant emotions are going to trigger pleasant behavior, which increases safety for all of the staff and all of the welfare of the patient. So how do we accomplish this? Typically, the easiest way to do counter conditioning is through food. It elicits an automatic, unconditioned, positive emotional response in all mammals, right? Even us, right? We wouldn't be motivated to eat if we didn't naturally respond positively to food, to palatable food. So ideally, with our shelter animals, we're pairing any potentially aversive stimulus, such as an injection, venipuncture, physical exam, even our first approach as a stranger. We are hopeful that the emotional response from the pleasure they find from eating this will then transfer to each stimulus. And again, it's best started as an initial approach, turning to the side, allowing the pet to approach us, offering that palatable food so that right off the bat, our first impression is one that's positive. And again, there's a number of things we can use, and not all of them have to be expensive, but it's certainly good to have a few really jackpot items in your stash. So the churu come in a little paste. I'll show you a video here later. For cats are wonderful. They also work great for dogs, particularly small dogs. Chicken or turkey baby food. Liverwurst such as Braunschweiger actually has fewer calories and lower fat than peanut butter. We do utilize peanut butter. We just want to be mindful of human allergies with peanut butter and making sure your staff doesn't have a problem with that. But lickable tends to work very well. We go through so much whipped cream at Gigi's here, as you can see in this video here, where a technician is removing sutures, and the dog is licking up whipped cream now. What you can't see out of view is someone is holding a leash. But again, ideally, we have someone just gently holding a collar while we're doing any sort of procedures on a dog, while they're happily licking and not even really realizing what's going on because they're super excited about the food. So we use whipped cream for a number of things here at Gigi's. All right, so microchip scanning. So this is something that should be standard of practice at the beginning of our intake, just to making sure. And even if you're bringing in dogs and cats from other partners, so we bring dogs from other partners who should be scanning, but occasionally they miss it or it gets missed there. So we have reunited many a dog with their families just from that initial microchip scan. But it's intimidating. Like holding this wand that beeps and makes noises and is going all around their body can be frightening. So it's important to do it in a gentle manner, allowing them to eat for counter conditioning, and just gently introducing the concept of the device and then gradually moving it around the body where we need it to be for appropriate scanning. You can see in this video, our technician here has lots of food, and this dog is very excited. The green body language here, low FAS. So we're offering palatable food. She did show the dog scanner and then fed her, keeping an eye on her, scanning all over her body. So again, taking low FAS and happy body language, right? But again, just running in and holding this giant responder right to their face, sometimes they're going to balk, back away, and then they're going to be afraid. I've seen a lot of, like, they're watching that. Like, don't you dare put that over my back. And so if we just introduce it with food and very slowly, then it goes much better. And you can get a more accurate full read on each of these pets. So injections, we can use counter conditioning for injections. So this puppy here is actually my dog who was being sedated for a neuter surgery. So he was my little rescue when he was a little pup. But you'll notice here in this video, they're doing a combination of desensitization and counter conditioning. So desensitization is where we start at a low level of the stimulus. So if it's an injection, we're starting just with maybe the touch of our finger, then the touch of either a ballpoint pen or a capped needle, and allowing the dog to eat at the same time. So they're gradually getting used to the concept that something's going to touch them in that area while they're eating. And then eventually, as their FAS levels go down, while they're eating, we can do the IM injection. You notice here, she's just starting with her finger as he eats. And then she starts with the capped needle while he's eating. Now, in between touch, the food's going away. So the puppy's actually looking forward to the touch because the touch means that food's coming. Now you notice his FAS went up just a little as he heard that cap come off the needle. So they went back to an easier level. And then there's the injection. Barely noticed. I will promise you that that puppy would have noticed had we not done that work and would not have enjoyed the IM injection. So, but again, no harm done there. This next video is sub-Q fluid. So this was a shelter pup that came to us severely anemic from a hookworm infestation and also needed a rear limb amputation. And so it looks like we're letting a puppy just sit on a table. Ideally, we'd have a hand on him, but what you can't see is that there is an assistant with a hand right there should this puppy decide to move. As you can see, we have this puppy eating chicken baby food while she injects a needle for sub-Q fluids. So we have this puppy, first medical experiences being those that are positive, the willing participant. He's getting a sub-Q fluid. He was severely dehydrated and anemic and actually required a blood transfusion. All right, for kitties, for vaccines, with our distal limb vaccination recommendation, this has created more of a challenge to provide fear-free vaccination. And so it can be very helpful to utilize counter-conditioning and desensitization for our feline patients as well. And so in this scenario, this cat is licking chicken baby food from an assistant, while the veterinarian, Dr. Susan Barrett, is starting with just some gradual desensitization by tenting the skin, touching the skin with her finger, touching it with a capped needle, and then injecting. And then the great thing about this video is that she follows up after the vaccine is given. She does a little bit more desensitization with the capped needle just to make sure she ends on a super positive note. And for the purposes of this video, the assistant is not putting a hand on the collar here, but for safety purposes, we recommend someone just gently scratching around the neck. So if we needed head control, we can have it. Again, kitty's FAS is low, green body language, happily participating in eating. So she's tented the skin and she was desensitizing with a cap needle. Now she's injecting. Kitty is still eating, not noticing it. And she caps the needle. She tense again and just says, hey, let's just do a few more, end on a good note. So this cat really leaves with a great memory for interaction. So that booster, hopefully the kitten is adopted by them, but if needed, or maybe when that kitten goes to the veterinarian for the first time in the adopted home, the experience is already going to start off better. So for dogs, same thing. We can work on desensitization with skin tenting, using our finger, using the cap needle. And in this scenario, you'll notice we had now the dog ended up, this is whipped cream in a bowl, and she ended up pushing it towards the wall. Ideally, I wouldn't have her smushed up against the wall, but this is where she chose to go, so we went with it. And I have an assistant just with a gentle collar hold. The dog is eating while I do some gentle desensitization and counter conditioning for the vaccine. So you'll notice minimal body language change with the injection. You'll see when I first started poking with my finger, she noticed and she stopped eating. And so we kept going, allowing her to eat before we started to do the injection. Great. So what I think has been a game changer for low stress and fear-free vaccination are these low volume vaccines. And so Elanco has this product, the TruCan and TruFel vaccine, ultra vaccines, available only in the United States currently. These are highly purified 0.5 ml dose vaccines. So for our pets that, that even if you saw the video, it took a few seconds to inject a vaccine, but if we can even cut that in half and have a lower volume that's going to cause soreness and get that vaccine in faster, so that we're minimizing any discomfort that these pets are going to have to experience. The other great thing about these vaccine options is that your TruCan and your TruFel Ultra combo vaccines are going to combine two vaccines in one so that it's even fewer pokes. So fewer pokes, lower volume, lower stress, less fear. So really a great fear-free option for our shelter pets. So you can see here, it's half the volume that a traditional vaccine is going to provide. And then I always recommend pulling up with a 22 gauge needle and then injecting, changing that to a 25 gauge needle to inject your vaccine with a 25 gauge so that the experience of the poke is minimized. Most of my patients respond very minimally to the smaller needles, whereas the 22 gauge, if we have to use a 22 gauge needle, we make sure we're changing it out for a brand new one, because a needle that's been popped through the vaccine vials is going to be dull and they're going to feel that more. So ideally a brand new sharp 25 gauge needle for injections after pulling it up in a separate 22 gauge needle. Some other benefits of the PureFill technology in the Elanco vaccines is the protein content is greatly reduced, so up to 75% compared to your traditional vaccines. And so that's going to mean fewer vaccine reactions, which is going to mean less soreness, less FAS post-vaccination. And in the studies that they did, 96.3% of dogs had no adverse reactions. So highly efficacious, lower stress, less reactions. Again, I think a game changer for not just all of our patients, but particularly our shelter patients who are already under a tremendous amount of stress. So here's an example of my rescue puppy getting a TruCan UltraVax combo vaccine. So same concepts as before, where we have food for counter conditioning. Seeing just a visual of the needle that's capped. Just start with skin tenting, paired with food, and then we just use the capped needle just to gradually desensitize him to the sensation of something poking his skin while he's eating. Again, the food serving for counter condition if he needs a refill here. Super excited, that's great body language there. We feel comfortable proceeding. So then she switched over to the capped needle still. A few more times just to make sure he's really happy about it. And then we switch over to the TruCan half ml vaccine with a 25 gauge needle. Again, you'll notice no body language change. I promise she did actually inject him. And then just to end on a good note, she finishes off with a few more capped needle pokes just for additional desensitization. Intranasal vaccines. So again, the recommendations currently are the Bordetella parainfluenza intranasal vaccines to stimulate immediately that mucosal immunity as opposed to the injections. Now, this is probably one of the most stressful things we do. In my experience, I have dogs do very well or reasonably well, particularly if we're feeding them and we're handling with a touch gradient and gentle control. Most of our patients are going to tolerate fairly well injections and blood draws. The intranasal vaccine is really hard for them. Shoving something up their nose that's cold, it's scary, is one of the hardest things we do. Ways to mitigate that are A, utilizing food, B, blocking the visual access to that syringe, and then trying to be as quick as possible. Now, the video I'm about to show you, my only recommendation for improvement would be to have that no slip mat there so this puppy's not on a cold, slippery surface. But I want you to focus more on the handling technique. So what you'll notice is that the technician that's vaccinating is using 2 fingers to block visual access to the syringe, and then using 1 finger that is laced with a bunch of easy cheese that the puppy is licking. It's not seeing the vaccine, and then she's very quick and doing small bits at a time to get the injection in his, or the intranasal injection to his nose. Licking, block visual access. Here comes for 1 nose, still licking. The rest. Again, this is a really hard prevention to give in a fear-free manner, but I think there are ways to do it that really minimize the distress that these patients have. All right, so I did mention that intranasal is the standard that's recommended currently by the Shelter Veterinarians guidelines. It's not a one-size-fits-all. I think there are some patients that are, even with the best of counter conditioning and desensitization, are going to be intolerant of the intranasal approach. It's really aversive to a lot of them. And so having other options that are still a modified live and are going to still stimulate local mucosal immunity are going to be helpful. So TruCan be oral. This is also an Elanco product. has the avirulent live Bordetella bronchoseptica designed for the oral mucosa. So this is not something that we want swallowed. This is not something we want given intranasal. It is for to basically be given in that buccal pouch so that it stimulates that local mucosal immunity. And it has been shown to provide protection against challenges to the primary pathogen, which is the bronchoseptica in that canine infectious respiratory disease complex. Comparable. So efficacy in the study they've done, and I have 4 studies that I can quote, are comparable to the efficacy in our intranasal vaccines. So having this in your toolbox or utilizing this from a fear-free standpoint, I think is important, even if it's not directly in the guidelines. I think I have so many patients that this is much more readily accepted for them than our intranasal options. So here's an example of a dog that does have a fear of intranasal, so it's really difficult, very stressful for him to successfully have a Bordetella vaccine. And so we're using Trucan B oral for him to make a better fear-free experience. And so what you'll notice is that I have one hand that's feeding him, and I have a syringe that is filled with whipped cream, all over the, not filled, but has whipped cream all around the outside of it. So when it comes in his mouth, he's excited about licking it. And he's also sort of distracted eating food out of my other hand while I gently put the syringe in and apply this vaccine to his oral mucosa. So I don't want him to chomp the vaccine, so I'm feeding him treats with the other hand and just gently slipping that all the way back to that buccal pouch, and then it's in and done. So, and he's, again, looking for more, very low FAS levels, green body language here. All right, when we get into blood draw, so for cats, if we're doing FIV, FeLV testing, if we can do this in as fear-free manner as possible, you know, in some cases, if we're doing spay-neuter, just go ahead and do this while they're under sedation or anesthesia for their neuter or spay surgery. But if you need this test result before you are putting resources into their surgery, then trying to do this in as fear-free manner as possible. And counter conditioning is super helpful. So you see this cat is eating chicken baby food. There's no scruffing. Ideally, I would have an assistant placing a gentle hand to scratch the head and neck of this cat. So if we needed to provide head control, we would. But this cat is doing so well. Again, very green body language, low FAS level, eating continuously throughout this blood draw. And we don't need to scruff and scratch. This cat didn't need foul restraint. Again, low FAS, just eating until the very end, eating more. And then for dogs, for our heartworm or 4DX testing, again, same concept, utilizing counter conditioning. We have Easy Cheese. And one helpful thing is that you can smear stuff on walls so that they can be licking while we do our blood draw. I love the rear limb lateral saphenous venipuncture for this because it's away from the head. It's less socially invasive. You just need to get good at holding off veins yourself. Now you could have an assistant here. Ideally, I'd have an assistant, again, holding a collar, but for the video purposes, we do this dog. This dog is very friendly with people handling him. But you could have someone else holding off the vein. But I would encourage those of you who do a lot of blood draws to practice on dogs that are easy, holding off the vein yourself so you can do a rear limb blood draw without having another person there. Where your other person is going to be helpful is that, again, that gentle collar hold in case head control is needed. But again, the food is so powerful. The counter conditioning here is so powerful. The dog is super motivated to eat. As you can see, this one came to us on the emaciated side, so was very motivated to eat. Again, low FAS, we can get this blood draw done quickly without, actually, I don't think we saw any FAS increase during this whole procedure. All right, so then we look into our parasiticides. So I know that shelters are going to make decisions on their oral versus topical parasiticides based on cost, right? We are buying in bulk, and so we often need to find the best deal possible that's still going to provide efficacy. And there are a number of options out there. I just want to speak from a fear-free standpoint that a lot of your patients might actually do better with an oral versus a topical parasiticide. So our oral meds are allowing patients to be willing participants in their care. You know, again, through counter conditioning, if we have patients that are eating and their parasiticide can be given as a treat, it's another opportunity for a positive interaction with our veterinary team. In some cases, it's more appealing to your doctors. So I know my mother hated topical parasiticides, because she hated the thought of touching that and potentially getting on our hands or having it in her home in the environment. Again, doctors are going to make decisions on what works best for them and for their pet. And I just want to put a plug in there that sometimes the one size fits all of everybody gets a topical flea and tick treatment or heartworm treatment. Sometimes doesn't work for all dogs and cats. And so I will show you some examples of how we can get dogs and cats to take oral meds. Sometimes then just a fear less. It's not fear-inducing at all if they're readily eating this, particularly if it's hidden in food. So just something to consider when making decisions about your oral versus topical parasiticides. So when we think about dewormers, most of these are the oral route anyways. We definitely don't want to be pilling. If we can, avoid directly administering medication to their mouth. Again, this is forcing them to take something that is not super palatable, which in a shelter situation where they're already super stressed could be risky for us handling their mouth. So ideally, we find a food that's highly palatable to the pet, whether that's canned food, Braunschweiger, chicken or turkey baby food, and we mix the medication with that. Whipped cream is another one. We mix Panicure with whipped cream on a regular basis. Again, they can't see a color change. The whipped cream is so palatable to them and it mixes very well. It's the same consistency once they start licking it. And so most of our pups are very willing participants. And, again, it's important sometimes to try the food because if they don't like the food, they're definitely not going to eat the food with the dewormer or other parasiticide in it. And so making sure you find something that they're crazy about and then mixing the medication or dewormer or parasiticide in with that so that they eat it readily. It's a great video show for cats. So for cats, if we're needing to give oral dewormers or other medications that they're not willingly eating for us, we can apply it to their mouth, but really allow them to willingly lick it so it's not something that's forced. I'm sure all of you have had that experience where you try to give an oral medication to a cat and they're fighting you, they're salivating. And so if we can make what we call this medicine sandwich or parfait, where we're adding something palatable both before and after, often these cats are willing participants and they'll actually eat the medication. Baby food or churu, medication in the middle, are palatable. And then the cat's mouth. The cat is willingly licking that. And again, it's a little bit of medicine, but it immediately has that chaser of palatable food right afterwards. For pills, for cats that we need to take pills, there is the option to crush the pill, mix it with something palatable, and sandwich that with the palatable food mixed with the medication, and then the palatable food again. But not every cats find baby food or churu as palatable. Some cats, like this cat here, actually prefer the treats. The problem is that cats especially, and this is true for dogs too, when they sense a texture change, especially if there's any bitterness in it, they're immediately going to reject it. So it's sometimes helpful, and it might be hard to see in this picture, is to add some crunchy texture to our treats. And so we do the 3 meatball trick here, where we have 3 treats. The first treat just has a little bit of crunch from maybe some potato chips. The second one has our medication, or this is actually potentially part of a dewormer, and then an oral dewormer. And then the last one just has some bits of potato chips. So it's a pill with just something yummy, but a little texture, a meatball with the pill inside of it, and then a meatball with just some crunchy texture. So it's the meatball trick where we do meatball with a pill, and then the meatball. So you'll see here, offering the 3 treats. There's a blank, so just some potato chips and pill pocket there. Okay. Then my second meatball, which has the medication in it. Then here's my third one. I should have been a little faster there, but this kitty. So by the time they realize there might be something in there, they have the 3rd meatball presented to them. So it's often like down the hatch if they're excited to get the 3rd treat. All right, and don't forget about chemical assistance, whatever we're doing. Even if it's our initial intake exam, some of our patients have FAS levels that are just too high to either safely or humanely do your full exam. So if we have FAS greater than 2 during exams, we're thinking about oral medications or any of the medical procedures. Sometimes if we get a dog or cat that's fresh off of intake, they've just been surrendered, or they're fresh off our transfer truck. Maybe they just need a hot second to kind of gain their bearings, acclimate to the environment before we actually put hands on them. So if we get a patient out and their FAS level is in the moderate or growing to that severe level, just take a break. Let them go back in the kennel, let them regroup. Let's increase our counter conditioning opportunities and stress mitigation efforts. Like, look at our environment. All right, what else can we do to mitigate audiovisual stimuli? What can we do to increase olfactory enrichment and decrease smells that might be aversive to this patient? Can we find a quieter area? Can we ask people to be quiet and not go past this room for the next 5 minutes? And if the pet is stable and nothing critical needs to be done that day, maybe we consider starting what we call pre-visit pharmaceuticals, so our oral medications like trazodone, clonidine, or gabapentin, and give them a few hours before we try again. If there's critical things, if you have a dog or cat that's injured or ill, and there are critical assessments or procedures that are needed, then that's the time to utilize our injectable chemical restraint, which I don't go into for this presentation specifically, but I do want to mention them. They are a tool for your toolbox to mitigate FAS in our shelter patients, even for wellness. And with that, I will conclude my talk. I'll thank our sponsors, Elanco and FearFree, for allowing this presentation today. And thank you for having me. And I have a few minutes for questions.
Thank you so much, Megan. What an incredible presentation. The chat has been going off, loving all of the different ideas, especially the kitty parfait. I don't know that I had seen that before, but that's incredible. Definitely will be using that. We do have a few questions here from the audience. We'll get started with the first one for, how would you suggest to do fear-free triage in pets that are entering to be spay-neuter, so they can't eat in that moment?
Mm-hmm. So a few things there. So we've actually instituted, for if it's high volume, high quality spay-neuter, so not ill patients, we've instituted trazodone for everybody. So everybody on the day of their surgery or day of transport is getting trazodone prophylactically. That has by far been our biggest game changer for reducing FAS in these patients, because it just takes one dog or cat whining, barking, meowing to set off the whole population. So we are dogs only at our clinic, so we're using trazodone for our dogs, but I think the same could be said utilizing gabapentin. That's where the science is for cats. Utilizing gabapentin for all of your cats on their surgery day, just to bring that FAS way down from the get-go. And then we have to think about our environment. So often the problem is we have a whole lot of animals all in one spot. So think about, what are they seeing? What are they hearing? What are they feeling? Blocking visual access from each other, utilizing classical music and white noise so that we are mitigating any stressors that they might be hearing or feeling. And trying not to have a pileup of animals, particularly before they're sedated, because that's going to increase their FAS levels. What I will also say is, if I'm not wanting to use food prior to anesthesia, which I will say we are comfortable using a very small amount, like we use whipped cream, because again, when they eat that, it's going to compress to be a very small amount. That's our comfort level. Other veterinarians have their comfort level. If you're not comfortable with having them in just a small amount of whipped cream, either while you give them an injection for sedation as your pre-anesthetic protocol, you can use the essence of food. So what that means is maybe we put chicken baby food or something meaty and very stinky in our fry trays or a styrofoam cup or a stainless steel bowl. We then wipe it clear and allow them to stick their head in and smell it. So it's kind of the essence of food where they're super excited, they're smelling it, they're licking it, and by the time they get the injection for sedation, it's over. So utilizing the essence of food can be very helpful. Scents can be very stimulating, particularly if they're a sense of meaty, delicious food.
I love that. That was such a great answer. Thank you so much for that. And the chat is still going off about everybody agreeing about the kitty parfait idea. We will definitely be stealing that video for you there. Another question here is, could you share any tips for people who may be dealing with doing intake exams solo, where they don't have an extra set of hands?
Mm-hmm. And that's really challenging. And I recognize that we are very fortunate here at GG's to have, we have lots of resources that we do often have. We have a scribe, we have an assistant who's helping and writing things down. We have a veterinarian and often a technician. But there's times where you just don't have that. And from a safety standpoint, that can be challenging, right? Because when you're doing these things, it can be difficult. But I would recommend for dogs that you have some sort of tether. so that your patient can be anchored to the wall, so that if something were to happen, you could move away safely from that. So from a safety standpoint, I think having some sort of tether is going to be helpful. But as you saw in that video, where I mentioned that ideally we'd have a second person with a gentle collar hold, in a lot of cases, if we're truly utilizing a fear-free exam, going slowly, offering that palatable food, we can do everything with one person. So like I said, we had cheese smeared on a wall. So I don't have someone to feed the dog, but I've got a wall that can feed the dog, or I have some sort of surface that, whether it's a cabinet or something that can be fully disinfected with rescue, that we smear our food on, allow them to lick. Again, using that fear-free approach where you're starting at the least painful, least socially invasive part of the body, and you're just starting with just touching you in a gentle manner, watching their FAS, and moving to the areas that you need to get done. Now, for dogs that are not comfortable with a blood draw, not comfortable with injections, if you don't have a second person, you're probably going to have to be looking at chemical restraint as an aid for you from a safety standpoint. Now, we certainly can do very quick desensitization and counter conditioning to muzzles if we're feeling that we need that. I don't want anyone getting bitten in this situation, but if you're by yourself, you can smear the inside of basket muzzles with food. And if they've never seen a muzzle before, most dogs will willingly put their nose into that muzzle. They will lick. You can fasten and unfasten, and sort of do a little bit of desensitization, counter conditioning. So they're comfortable wearing the muzzle. And then again, you can still smear food on the wall and they can lick through that muzzle if you need to. And you can still, again, utilizing the gentle control, the touch gradient, and food are going to be super helpful if you're alone. That tool is going to be your partner in this examination. And I can't imagine doing an exam alone without the use of food for counter conditioning. It'd be very challenging to keep stress levels at a minimum.
All right. And then the last question we're going to have time for today here is one about the traz that you're administering. So are you giving trazodone the night before and 2 hours prior, or just the 2 hours prior for your surgical patients?
I think ideal recommendation would be giving it the night before and the morning of. For us, a lot of our dogs are already on trazodone if they're showing any level of FAS, and so we are currently just doing the morning of. But I think if you're a shelter, particularly if you're not utilizing for any FAS already regularly, then yes, the night before and the morning of are going to be ideal. I think that fear-free recommendation comes from a client standpoint where you have client anxiety, pets anticipating what's happening, and so having that on board so that the timing is right, and that they are, particularly for cats, who are starting to increase their FAS just seeing the carrier come out. But I think for shelter pets, if you have the ability to do the night before and the morning of, if you're not already utilizing trazodone in your population, would certainly be helpful. But at minimum, the morning of. We can ideally get it 2 hours before we're going to be taking them out, but at minimum 1 hour.
Thank you so much, Dr. Herron, and thank you again to our friends at Elanco for making today's presentation possible. And I want to thank everybody for taking the time out today to enjoy the webinar. A recording of this presentation will be available on fearfreepets.com within about 2 weeks, and your RACE CE certificates should be emailed to you within the next 7 days. If you have any questions, you can always visit us at fearfreepets.com, fearfreeshelters.com, or reach out to our customer experience team at wags@fearfreepets.com. We thank you guys again for joining us today, and we hope you guys have a great rest of your day and rest of your week. We'll catch you next time.
Thank you.